Scientists warning of a second surge in coronavirus cases in South Africa over the next few weeks. In the Gauteng province, the government says it's working on measures to deal with a possible increase in new infections. So close to 3,500 new beds are expected to be added to the provincial hospitals by the end of this year. So existing wards will be refurbished and new wards will be constructed through the use of alternative building technology. So Wits University professor Bruce Milado, who's also a member of the Gauteng COVID-19 Advisory Committee, says the model his team is using shows a high risk of a second surge. The team is monitoring countries like France and Spain, which have experienced a peak in infections since March. So this is today South Africa marking 200 days of lockdown in South Africa. Dr. Kerrin Begg, who is a public health specialist, joins me now to chat a bit about this. Doc, a very good evening to you. Thanks indeed for your time. So how likely is a second surge of COVID-19 infections in the country?
It's certainly likely. We've learned from other countries. We were able to be that little bit behind the Northern Hemisphere, and so we're able to watch what was happening. And indeed, our experience mirrored what other countries were experiencing in terms of the first peak and the first wave. And we've certainly seen that most other countries are now moving into, after a lull period, are now moving into a second wave. We know that this is how epidemics occur. We know that this is how we've seen significant pandemics, such as the Spanish flu in the past. So certainly it's highly likely.
Yeah.
What's interesting around the Northern Hemisphere second waves is that it does appear that the mortality seems to be lower than the first wave, which is interesting. And there might be a number of purported reasons as to why that may be, but that does give us hope.
Yeah. Doctor, if we look at the numbers which I've just read, what can we tell from the trajectory in terms of the virus since South Africa had released or had relaxed, its lockdown regulations?
So what we are seeing is a slight increase in number of daily cases since we've returned to lockdown level 1. We've also seen reported daily deaths start increasing again above 100. So we had managed to have daily deaths below 100 for some time. Yeah. And then we're starting to see that the number of positive cases per the number of tests done is also starting to increase back up to around 12% of every test of the number of tests done. So out of every 100 tests, we're back up to about 12 tests being positive, whereas we got down to around 5 or so. Mm. So there certainly does seem to be early signals, certainly starting around about the beginning of last week and just the weekend before, that we are starting to see increases again uniformly across most of the provinces.
Doctor, with now this second surge, which is likely, you say, I mean, there does seem to be non-compliance to some of the regulations, including the wearing of masks, as government relaxed the lockdown in South Africa. How dangerous is this then? And for, I guess, there to be constant communication about these non-pharmaceutical methods that need to be stuck to avoid, a possible disaster.
Correct. So part of the challenge that we've been warning around for some time is COVID fatigue or pandemic fatigue, where people get tired of continuing to live in a slightly restricted way. But it does need to become part of our new normal. So this COVID fatigue, we're living in this heightened, state of anxiety with higher levels of the sort of flight or fright response, where we're needing to live with this, with our adrenaline levels high. And so the natural response is that we want to revert to normal. But we really need to guard against that. Yeah. And it's very clearly shown that the clusters and outbreaks that we're starting to see again, we were just discussing some school children outbreaks this morning at a provincial meeting, is absolutely related to non-compliance and non-adherence, rather to mask wearing, to physical distancing, to being in open air, to sanitizing, but particularly mask wearing and physical distancing are some of our key measures. Yeah. And I think we just simply don't understand just how effective those are. They seem to be so simple, but they really, really are so effective in keeping the virus at bay.
Yeah. Doc, Australian researchers have also found that the virus that causes COVID-19 can survive on banknotes, glass and stainless steel for up to 28 days, much longer than the flu virus, highlighting, I guess, the need for effective cleaning and hand washing to help combat the disease. What's your view on that?
So what's interesting is that the vast majority of the spread that we've been able to see is actually non-fomite spread. So we call that fomites when you're picking it up from surfaces.
Yeah.
And whilst it is important, the actual crucial bits is that it's person to person. So viruses like warm, wet environments. So even though you might have been able to detect viral material, genetic material on a surface, that doesn't mean that it would necessarily have caused an infection. So we really need to be aware that people give the virus legs, and the transmission from person to person is by far the highest risk factor. And it's very difficult for people to take cognizance of and to adhere to, because we want to be social. But that's really the spaces that we need to be concerned about, is retaining physical distancing and masking. And yes, absolutely, we need to keep surfaces clean, etc. But our really big risk factors are person-to-person spread. And masking and physical distancing are our key measures for doing that. Sanitizing our hands so that we don't transfer from ourselves to others. But fomite spread is a distant risk. And nevertheless, we do need to look after it, but our highest risk is really from person to person.
Dr. Kerrin Begg, thank you very much indeed for your insights this evening on The Full View. Public health specialist Dr. Kerrin Begg joining us this evening. So coming up